Hello, I'm here with Dr. Robert Pate, licensed psychologist. Really excited to get to know a little bit more about you. So, how's it going, Dr. Robert Pate?
Very good. Looking forward to sharing. Sounds so
Awesome.
formal.
Yeah, so I have a couple questions for you. First question off the bat is what led you to want to become a therapist?
Oh man. I would say my journey to becoming a therapist started as a college student. I was the president of a club at the time at my school, and for whatever reason, I was I still am a dork, but I was also pretty immature. I don't feel like I really had much wisdom to share with anyone. I'm not sure whether I do or not. But I'll leave that up to other people to decide. But people just wanted to talk about things with me. If they had a problem in a relationship or something was going on at school that was hard for them, they just naturally wanted to talk to me. And I enjoyed that. I enjoyed hearing their stories. And I had a great mentor in the psychology program at my school. And he was also the head of the honors program. We got to spend some time together, and he encouraged me to pursue becoming a psychologist. And to be honest, I wasn't really sure what all that meant at the time. But I knew I liked helping people, and I knew that somebody with a lot more years of experience and wisdom under his belt thought that would be a good fit for me. So I started looking into it. And so I'd say that's what kind of got me started on it. Um, I would say, in terms of why specialize in therapy versus some of the other things that psychologists do, like psychological testing, maybe, or like advocacy work at the government level, something like that. I really just enjoyed over the years getting to know, again, people's stories, but also helping them through those stories. And just, I don't know, I like being part of somebody else's world. And
Yeah.
that's always been my approach. Yes, we find solutions together. We look to solve problems, but it's always in the midst of finding out what's going on in their world. So I try to understand people within their specific context, because as much as I can be the expert on certain therapeutic techniques or theories of ways to help people, things like that, they're always the expert on themselves. So it's always a co-learning process where I'm getting to learn about them and their story and how they see things, or how their partner might see things differently from them sometimes. But it's always in that context of what's going on from them, what's their worldview like, and then how can I start to see things through their lens so we can find a solution that fits for them, not something that I think would work for me.
Wow. Yeah. Okay. That's awesome. And that kind of leads me to the next question then I have for you is who would you say is your ideal client? I thought I heard a little snippet of it, but kind of just curious to hear a little bit more about that. So who would you say is your ideal client?
Yeah, and you're not wrong. So I do love working with couples. I've been enjoying working with couples for a number of years now, and I really enjoy distressed couples. So I do some premarital counseling, and I've written a little bit about that and some blogs and articles. But I would say distressed couples is kind of my sweet spot. I like couples that have been together for a while, and have some patterns, some ways of being with each other that maybe they have not come to enjoy over the years. And honestly, if we think about when do people come to therapy, it's not usually the first thing that people do. They usually just try and dismiss it. It'll pass. It's not a big deal. And then when they realize it is, maybe they read a book or they Google thing, right? I mean, like, how many of us have Googled, like, how do I get my kid to stop yelling or something like that, right? How do I make my husband love me again, right? That we've all done the Google search to try and solve our problems. But when that fails, when trying to just let it go fails, when talking to a friend or a family member, a pastor, or whoever it is that you confide in, when those things maybe leave you wanting for a little extra help, a little extra guidance, that's when people usually come to therapy, right? So we
Yeah.
don't get people at their best usually. Occasionally we'll get somebody who says, I want to just personal growth. I'm doing great. I want to do even better. And they're really fun to work with, right? But really, I really enjoy distressed couples because the reward, I think, for that work just personally is so tremendous. I love getting to see people who maybe come in and maybe they're in a relationship that's been really sour for a long time. Maybe they haven't been intimate in any of the ways in years. And it's just so rewarding to see, like, maybe they were separated when they started and now they're not. They're having a better experience as parents of their children of whatever age, right? Because they're working together on things now. They're collaborating instead of putting their children against them or something. So I really love working with couples, but there's another theme here maybe emerging, that it's not even so much about what's the presenting problem or diagnosis or whatever that somebody might come in with, but I really just love to work with people who are ready for a change. Uh,
Yeah.
Change is hard, change is scary. It takes a lot of courage, and maybe even a little tenacity about your own life to call a therapist, or to, in our case, sometimes email or text a therapist, right? Try to be convenient if we can for people. But to reach out and set up that first appointment, it takes some guts, and it's not easy to do. So I really enjoy working with people, individuals, couples, families, whatever it might be, when they're ready for something new. um, I remember a long time ago, I can't remember who told me, but um, hearing the phrase that people tend to stay the same and keep doing the same thing until the pain or the stress of doing the thing they're already doing is worse, or is more difficult to deal with or manage than whatever the fear is that's down the road, right? So if it's like, if I change, is this going to be harder? Right? So when the pain of now and the thing I've been doing, when that becomes worse than the thing I'm afraid of, that's when I go try and get help. Right? So I love working with people that have hit that point and they say, you know what? I'm just ready to do something different. I'm willing to invest in myself, in my relationship, my future, and to do the hard thing, the hard work of sharing my story and getting some feedback. Right. So trying to help people find a new direction is what Green Line Psychological Services is all about, right? That's one of our taglines: find your new direction, right? I love it when people come in and they're ready for that new direction. So whatever the problem is, I don't know that there's a specific age range or something, or presenting problem, but people who just want to do something different in life. I love helping people kind of make that shift.
Absolutely. No, that sounds wonderful. And so, kind of just stepping outside a little bit of I guess therapy talk. What are some special talents that you hold, that you have, that you would like other people to know?
Oh my gosh. Well, I, I'm a bit of a dork. Kind of always have been. I've never been accused of being cool in my life, and I'm okay with that. And I would say if I could go back in time and tell teenage me that, I would have been so much happier. Like, you're gonna be fine. It's okay to be a dork when you're 40. It's okay. So I love playing nerdy board games with my family, with my in-laws. I love the outdoors, whether especially when it involves anything with sports. Um, I've got three kids, and the oldest is really just starting to get into sports. So we love coaching his soccer team. Starting to get into football a little bit, right? So I love athletics. I love nerdy stuff like board games. I really enjoy karaoke. And people always want to know, like, what's your song, right? So I love anything Michael Bublé. My range is close to his. And although my range is not close to Billy Joel, if I'm having a good night, I might bust out Piano Man. So so I have a little fun with that. I don't know. I'm kind of all over the place with what I enjoy, but I don't know. Maybe that lets you behind the scenes a little bit. That I like to have fun, and just part of this is like getting to know what it would be like to work with me, right? And
Yeah.
I like people to know that I take my work seriously, but never myself, right? So
Mm.
I try to be as humble as I can. I don't know everything. I'm a great fit for a lot of people, but I'm not a great fit for some people, and that's why I think it's important that people get to see things like this, and maybe give us a call and talk on the phone to see, is this somebody I can talk to? And so when people are thinking about that, I like to have a good time, and there is a time to mourn. There's a time to grieve. There is a time to be sad, to be anxious for things. But there's also a time to smile, to laugh about things. And sometimes the laughter comes with relief. Sometimes it comes when we realize that we've been kind of foolish about something and we're laughing at ourselves. And sometimes things are just plain funny. But I would say I laugh in almost every session with my clients. It's rare for me to have a session without having a little bit of fun, a little bit of humor thrown in, because life is just too ridiculous to not laugh at it sometimes. So um, I don't know. I'm happy to answer a little more, but those are some things that come to mind for me.
Awesome. And I'm sure, as time goes by, people will get to know you just a little bit more. Um, So one last question I have for you then is, what piece of advice do you find yourself um, giving out from time to time, and that you feel like, yeah, like I feel like that can speak to different people?
Yeah, something that comes up a lot, and this could apply to a lot of different people in a lot of situations. So I'll share this here. Um, and the answer, it relates to that statement about it applying to a lot of people. So nuance matters. Right? It's just one of the things I've come to learn over the years. I've been doing therapy, I don't know, 17 years or something now. And nuance matters. I mean, that's the best I can say. There are no magic phrases that will fix your depression, that will save your marriage, that will help your kid listen to you better and quit smoking whatever it is they're smoking, right? There's no magic wand, there's no crystal ball, there's no secret sauce, there's nothing that will magically fix things. Nuance matters. And so when you come to see a therapist, if it's me, if it's Saul, if it's any of our other therapists at GPS or anybody outside of here, whoever you talk to, they don't have the magic answer either. So I can tell you that it will take work. Sometimes more work than others. Kind of depends what you're coming in for. It depends if it's couples, if your partner's willing to work. It does take two to tango. It takes two people to fully save a relationship, to have a healthy relationship. But you can do a lot of the work on your own, and you can create a safe space for your partner. But again, nuance matters. So there's no magic phrase here. I wish there were. I'd be a lot better at my job if there were. But what I can say is that when I work with couples a lot, even with individuals, there might be a phrase, right? I'll sometimes have people say, man, I wish there was a dr.pate app, or like, can you say that again? It just sounded great. And I'm just speaking off the cuff, and it's just what comes to mind and what feels like it fits in that moment. But I would say that people get a little too attached to the specific words, and what's missing is the personal nuance in what they're sharing. So when I ask people to do something different, it's to do it different in their own way. Right. I'm also a professor. I'm a director of clinical training for a doctoral program. And I try to teach this to my students as well. I want them to not internalize me too much. I don't want to create a bunch of little Dr. Pates running around. So that's not the goal. The goal is not every time we watch one of the master therapist videos where they're trying to learn these therapy skills. The goal is not to become like these people. The goal is to take some of what we see and then do it in your own way. And so I sense for my clients that there's this similar uh, temptation, maybe, as my students have, to try and mimic what they see, as opposed to trying to figure out, well, how does that fit for me? How can I use a phrase that's like that? Or what is that phrase conveying to the people in my life? If I'm looking for a raise, right? I want to make more money, but I'm a little self-conscious. I'm insecure. How do I come across as strong and confident and worthy while also coming across not as a jerk, right? Just, I deserve this and I'm speaking up for myself, but I'm also relatable and trying to communicate with someone in a way that wants them, gets them to want to give me a raise, right? So there's nuance in that, right? So same thing for couples. There's not a magic phrase where I can say, if you say these words when your wife is upset, she won't be upset anymore. Well, it might have sounded good when I said it a couple minutes ago in session, but you got to find your way to say it, buddy. Like that, there's a way that you can do this that will let your partner know, I care about you. You are safe with me. You matter. What's important to you matters more to me than what's important to me. Right? That's the mindset sometimes that we're trying to get across to our partner. So it's like, how does that happen for you? Nuance. So I'm sorry, this was like a giant nugget, but I feel like it impacts everything about therapy and life, right? It's a little more than a nugget. It's like the whole happy meal. But it's like, if people could approach therapy with this idea that nuance matters and come in with an open mind, an open heart, a willingness to, as I said before, do something different, even if it's something small. I think those small changes, those little nuanced changes, can really make a big difference.
Absolutely. Thank you for that. It kind of reminds me of this idea, growing up, a penny at a time, it adds up. So
Mhm.
like you said, nuances matter and they add up. So Yeah, I think that's wonderful. Well, thank you so much for answering these questions for us, getting to know a little bit more about you. Greatly appreciate it, and looking forward to seeing what comes up for GPS in itself.
All right. Thanks, so.
Of course.